Hi guys, welcome to part B of our presentation which is on dysphagia. Previously, my friend Abhijit has explained part A and I think he has done a fantastic job. Okay, so let's get things going. My first slide is safe swallowing practices during dysphagia. Ensure that the patient or resident is always sitting upright while drinking. Encourage small sips of fluids and encourage gulping. Make sure that they swallow a drink before taking more. Do not give them drinks when they are lying down. Try them with dysphagic drinking devices like nosy cup or sippy cups. Strategies to improve hydration in dysphagic patients. So these slides basically focus on like how a person can improve hydration in dysphagic patients. So these are some of the strategies which I am going to explain. Ensure they receive a daily intake of a minimum of 1500 milliliters of free fluids in 24 hours. Second one, ensure they receive 75 to 85% of fluid intake with meals and 20 to 25% at other times such as during medication or snack rounds. So third point is offer a variety of fluids, especially their preferred beverage of choice to increase their fluid intake. Check in with their families to determine their thirst and drink preferences. For instance, coffee with 2 sugars and milk, or green tea, or nectar juice, or like cranberry juice, or orange juice. So the fourth point is ensure their drinks are within reach of them at meals and snacks. Keep a daily fluid diary with all the targets agreed upon by the individual and multidisciplinary team. I think this is a very important point because you need to record their hours, like how much they are drinking. Ensure staff to provide verbal prompts to help, as well as assist them by lifting their cups to their mouth. Again, this is also a very important point. Like you have to encourage dysphagic patients that they can complete the full glass of water or juice. Moving further, thickened fluids. So basically there are three types of thickened fluids. First one is mildly thick, also called nectar thick or cream thick, which can be drunk out of a cup. Second one is moderately thick, also called honey thick, is similar to a milkshake and pours slowly. Unlike real milkshakes, these do not get thinner as they melt. They are often eaten with a spoon rather than drunk from a cup. And the third one is extremely thick. As the name suggests, this one gets extremely thick. As a result, it's also called pudding thick, smooth or extra thick. Can't be poured and must be eaten with a spoon. Fluids to choose thicken. Like which fluid should be chosen to be thickened. So these are the list of fluids. Like thin fluids like water, milk, tea, coffee, or carbonated beverage and juice needs to be thickened. Some beverages such as smoothies and milkshakes may already be at the appropriate nectar thick consistency, but watch out for melting. Frozen liquids are not thick liquids. Consider the consistency of liquids if they melt. Ice is solid, but in the mouth becomes a thin liquid. Fluids to avoid on nectar thick diet. On a nectar thick diet, individuals should avoid all thin liquids that have not been thickened. As previously mentioned, anything that melts such as ice cream, popsicles, frozen yogurt and ice cubes should be avoided. Also, fluids combined with solids such as chunky soups or jello with fruits should be avoided. Okay, so we are going to discuss some merits of thickened fluids. Like thickened fluids improves psychological and functional swallowing. Second one reduces aspiration detected by imaging. Third point helps to keep the body hydrated in dysphagic patients, which we have already discussed in the previous slide. Normalizing swallowing patterns during aspiration and enhancing sensory input. Help prevent choking and stop fluid from entering the lungs. And here are some of the demerits of thickened fluids. No definitive evidence of reduced risk of pneumonia. Second one, impaired bioavailability of medication. Third, adverse effect on HRQOL. Fourth point, risk of malnutrition and dehydration. Fourth, reduced palatability, the fact or quality of being acceptable or agreeable to the tastiness. That means the taste buds of the after consuming these fluids, the taste buds usually gets affected. So this point explains this. Next one, constipation and loose stools. And the last one is gasiness, means the patients can feel a little bit of stomach upset, or they can feel a gaseous situation in their stomach. And these are some of the references, and here we go. Thank you very much for